AFHEG Foundation, championing health literacy.
In this video, we delve into epilepsy, a neurological disorder causing recurrent seizures due to abnormal brain activity.
What is epilepsy? Epilepsy is a chronic non-communicable disease/disorder of the brain characterized by repeated seizures. It's essential to understand that epilepsy is not contagious. According to the World Health Organization, approximately 50 million people worldwide are affected by epilepsy. It can affect people of all ages and has various causes, including genetics, brain injuries, or underlying medical conditions. What is a seizure? A seizure is a sudden change in behavior caused by a temporary alteration in the brain's electrical functioning. What are the types of seizures? There are different types of seizures associated with epilepsy, and these include: the two broad categories of epileptic seizures are generalized seizures, absence, atonic, tonic-clonic, myoclonic, and partial, simple and complex seizures. Within these categories, there are several different types of seizures, including: generalized, involve both sides of the brain. There is loss of consciousness and a postictal state after the seizure occurs. Focal seizures take place when abnormal electrical brain function occurs in one or more areas of one side of the brain. Focal seizures may also be called partial seizures. What are the causes of epilepsy? Epilepsy has various underlying disease mechanisms, but its cause is still unknown in about 50% of cases globally. The causes of epilepsy are divided into the following categories: structural, genetic, infectious, metabolic, immune, and unknown. Examples include: brain damage leading to epilepsy can result from various causes, including prenatal or perinatal factors like oxygen loss or trauma during birth and low birth weight, congenital abnormalities or genetic conditions causing brain malformations, severe head injuries, strokes restricting oxygen to the brain, infections like meningitis, encephalitis, or neurocysticercosis, certain genetic syndromes, brain tumors. What are the signs and symptoms of epilepsy? Signs and symptoms of epilepsy can vary depending on where the disturbance in the brain starts and how far it spreads. They may include loss of awareness, movement disturbances, and changes in sensation, including vision, hearing and taste, mood, or cognition. People with epilepsy are at higher risk for physical injuries, anxiety, and depression. Let's understand some of the seizure triggers. Identifying seizure triggers is crucial for managing epilepsy. Common triggers include stress, lack of sleep, flashing lights, certain medications, and alcohol. What are some of the seizure first aid techniques? Knowing how to respond during a seizure is critical. Learn basic seizure first aid, including ensuring safety, protecting the person's head, and turning them on their side. What are some of the epilepsy treatment options? The treatment options aim to control seizures and improve quality of life. Anti-seizure medications are the first-line treatment for many epilepsy types. For drug-resistant epilepsy, dietary therapies like the ketogenic diet or surgical interventions may be considered. By raising awareness about epilepsy, we can break stigmas and foster an inclusive environment for all. Thanks for watching.
AFHEG Foundation, championing health literacy.